we've spoken at length to both of you, and we are so grateful in our community for what you do. You know, as a previous job as a nurse here in Scranton, practiced here in Scranton and worked at an outpatient surgery center. And when you have surgery, you go home with prescriptions. And we send lots of people home these days that, you know, they're still a little foggy under anesthesia. They go home with their family, and inevitably they get home and they have the instructions in front of them, and they say, I have no idea I'm home now. The anesthesia has worn off. You know, they have this list of meds. And it was your places that would call the surgery center and say, hey, you know, you sent Mary home with this script. She actually has an allergy to this. Mary has taken this in the past. We have this in a record, and she broke out in hives. You were the ones that were this, you know, almost like a second leg of the care, the continuity of care that is certainly not unique here in Scranton, but I know around the Commonwealth. But here in Scranton, we have very generational families that, you know, they've been to your pharmacy, their parents were there, they take their kids there. You know your patients, and that is what I feel the loss of your places. If you can't, like Eric, you say 2 years max, I can hold on. And I know, Tom, you're struggling yourself. I know it's. So my question is, you know, with all of the, you know, the way up here, the issues that we have to deal with, your patients, have you been able to tell your patients, look, I want to fill this script for you, I want to deliver this script for you, I want to talk to you about the side effects of this, but, you know, I'm losing $400, $300, $80 every time I fill this. How transparent can you be with your patients? I didn't know this, just like Representative Benham. I didn't know until Tom schooled me up quite well on PBMs. I mean, he's passionate. You know what's coming. You know the for the patient. You know how much. You know how. That's my question. How much do our patients know, and how transparent can you be with them? With what is. I don't know if you've ever had to turn patients away and be honest, like say, look, I want to take care of you here, but I hate to do this, but go to CVS, go to Rite Aid. It's I can't do it any longer.
Yeah, I think one of the balance is we're there to provide the care to our patients. In some manner, I believe we're almost parents of our patients because we protect them from all of the bad stuff that goes on in the background, meaning we don't bring the financial piece into the conversation because it doesn't feel right as a pharmacist to bring that into the conversation. There are